Welcome to Doorstep Healthcare Nigeria Limited, where we dive into important health topics. And today, we're here to talk about sickle cell. I am pharmacist Bagidinjuma Gabriel. Here with me, it's a passionate person, a sickle cell ambassador. She's not just a person, she's a champion, I bet you. See, just get a seat, sit down, and let's get started. You're welcome.
Thank you for this beautiful introduction. My name is Miracle Danjuma. I'm from Cohort Sickle Cell Foundation.
Welcome, Ma.
Thank you very much.
How is Cohort Sickle Cell Foundation?
All doing well. To send their regards.
Oh, well, we appreciate. Doorstep appreciates your Doorstep appreciates you accepting to come. I knew it was a short notice, but then here you are. Thank you very much. So, like from introduction, I said we are to talk about sickle cell. Yeah, and then like I don't want us to do the pharmacy thing. Let's not be as if we are here to show ourselves. You get, but then it's June 19th, and then in the world, it is thought as an awareness day for sickle cell. So when that was why, as from doorstep, we actually thought of inviting somebody who is not just from the health line, but getting from somebody who has the experience, somebody who is actually a champion. I want to be. I will just keep saying champion. Yes, yeah. Who is a champion, and then the person to share uh, knowledge, for me to say wisdom, yes, that will keep people who are living with sickle cell going. So, also first, um, how familiar are you with the different types of sickle cell disease?
So basically, when we were growing up in our secondary school, we were familiar with just the three types of genotype, which is AA, AS, and SS. But afterwards, and due to research, like I said, I'm from an organization, we came to realize that there are a lot of genotypes out there that we don't know of, which is basically other disorders, not that gene itself. That is the SC, the AC, the CC, and the rest.
Okay.
Yeah.
Okay. So the AC, the CC, the SC, are they do they have this? Are they really inclined to this sickle cell?
Yes. They are actually, some of them do go for same checkup as the sickle cell patients. They go through crisis episode also, but it's not as severe as the HBSS itself. That's the hemoglobin SS. But they also go through crisis, and some will say they go through worse crisis than the SS. That I can't give full detail of. I am HBSS, so I guess that's like basically the aspect I can give my own answers to.
Since speaking, I'm pharmacist, but then I just learned something right now. That is, it's not everybody that will have that sickle cell crisis that is even sickle cell.
Yes.
So please, hey, please, 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 we should not really have this internet thing in our head, and then probably we see someone with crisis and start saying, this is sickle cell, this is sickle cell.
Yes.
Okay, probably.
But they call all of us sickle cell actually. We are all sickle cell since we go through the same pain episodes and all.
Okay, but it's still advisable they should go check.
Yes,
so that
go
we know if
check.
it's
You
SS
know where
or
you
it's
fall.
SC.
Yes,
Yeah.
SC and all.
Okay, that's nice. Okay, so what do you know about the potential complications of sickle cell disease?
Its complication is basically the major part of the body. If not proper taken care of, it does not just affect the minor parts, it affects the major part, like the kidney, the liver, the joints, the gallbladder, and the rest, like your major part of the body, the lungs, because you know what sickle cell is all about.
Just say the person. Just say the person. Just say the person. Wow, wow, wow. Okay. So, do you know what to do if you experience symptoms of crisis? Okay, like let's start from the symptoms before. Yeah, okay, yeah. So what should it be? What should someone do? Okay, or what are those symptoms that um, that we will see. Okay, let's even still incline to the diagnosis, kinda. Okay, when were you first diagnosed of sickle cell, something like that? Then you grow up.
So I was born with it because sickle cell is a genetic disorder that is inheritance from both parents. The S gene, those they transferred it to me. So it depends. I feel everybody has a certain age that they found out who they are. So someone like me, I found out at the age of 3, or was it 2.5? That was when I found out. So that's just all I can say. And the pain symptoms, stress, everybody has what or how their crisis starts. That is how they experience it. But I can boldly say, out of 100%, I am speaking for 80% because I have communicated with a lot of sickle cell patients, and I'm like, oh, how do you experience your crisis? And I'll just say we all experience same kind of crisis. That is, the first is from the lower part of your back, that is your waist, the sharp pain connected to the chest, the breasts, and so on and so forth. Yeah, so that's like basically one of the first stage, or will I say the first signs?
Okay. So are there any specific triggers
Yeah,
to okay, so
yeah. First of all is stress. Stress. And why do we go through stress? Is our daily activities. Compared to AA, compared to AS, we have, not like we can't do anything per se, but we have limits. If your strength is for 8 hours, ours is for like 4 hours. But a lot of us want to say, I have to reach that 8 hours. Why? Because you call yourself a pharmacist, yeah, and I can also be studying pharmacy, yes. So I have to meet up to the same calendar that you're meeting up. And at that point, my body might not be able to take it. Like we know, sickle cell affects the red blood cell, and you know the red blood cell is responsible. It's like it's the person exactly himself. So it affects the red blood cell. And you know our red blood cell is responsible for blood and oxygen from the lungs to other part of the body. So imagine before that blood finish pumping the next one, you are going to so please. In fact, as a castle student, you are going to CBA building for your first lectures. So at what time is that blood going to circulate? And before you know, that is where the stress comes in. And at that point, your dehydration level becomes very high. Because I think the number one best friend of a sickle cell is always be hydrated. And before you know it, you are dehydrated. And all those things are crisis triggers. You will say, okay, I can take it when I reach home, or when I go for my next class, I'll get water. No, there's no time. They'll say, no, the next class is in SLT1. You are ready to go and get the front seat. There's no time. And then before you know it, the more you stress that lungs, your oxygen level reduces and your performance becomes poor. So you see, stress is one of like the biggest. Then your hydration, when you become dehydrated. And then also air, that oxygen I spoke about earlier. Sometimes in the class, it can be too stuffy for a sickle cell patient. You have a lot of people in the class, so you don't have access to natural air, and you have to force yourself to just inhale that little oxygen you get around you. And they tell you. So at some point, a lot of people don't even notice that. And sometimes rain.
okay.
Rain is also a trigger for some people. There are a lot of trigger out there. That's cold weather, heat, over excitement. Because when you are too happy, you can go through crisis. When you are too sad, you just have to observe minimum, like just the middle way. So that's just it.
Yeah, initially you said okay, when you knew yourself.
Yeah.
Yes, you said at 3. You get, so does that mean that there are okay, yeah, sure, three you are still a baby. But
I'm
let's say
still a baby.
parents helped, yes,
Yeah.
good. So but then I have encountered people that they are sickle cell, and then their parents are not accepting it yet. Even they themselves, they are not accepting it yet. So they will still keep going to churches, doing this, doing that, doing just they feel there is a magic that can happen, or probably some say we will say it's village people. Thank you very much. Yes. So uh is there a stage that or is what is it as me that is not a sickle cell person, me, I'm
Yeah.
accepting myself as a person. Like you said, okay, we are both, if we are both pharmacy students, I go, I feel I have to push, my energy is full. Sickle cell person wants to push, his energy is full. So see, I'm accepting myself as a person. So should a I guess a sickle cell person too should do that to himself, right?
Yes.
Okay.
Um, I would like to go back to the fact where you said some parents will have to go to prayer houses and all. Now it all comes to the genotype itself. Someone like me, I'm even glad you actually brought this question. Someone like me is one of the results of such because, like I said, I found out, or my parents found out, I was a sickle cell patient at the age of 3. And when they found out, they were like, "How did I give birth to a sickle cell patient child?" Yes, because after when that is when I grew up and I have knowledge, I had to go back behind them to make proper inquiry and be like, I hope say these people don't know they go get married because if they know, problem go there for this house.
This foundation is the same for you.
Yes, it's very important. But then I get to realize that mine was due to medical error.
Okay.
So now that is why I said I was happy with the question you asked. My parents were not expecting to give birth to a sickle cell patient because the medical reports were with me. I'm not going to mention the hospital or something like that, but they were telling my parents before marriage that they are AA. My mom was AA, my dad was AS. About 3 of their results showed that. So at the age of 3, it was even my godfather that was like, take this child to the hospital.
Sorry,
Yes.
the three result
Yes,
is
the
it from
3 results. No, 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 not same. That is why I'm telling you. That
three
case,
from three
yes, from 3 results.
different.
Yes, and different hospital.
Wow.
Yes. It's not something that they told me, but it's something that I went to find out. I had to go and dig in because, being a sickle cell patient is something else. So you have to be like, how comes? Yes, and it got to the point where some children grow hatred from their parents. So, like I said, it happened to me because my parents were like, I can't give birth to a sickle cell patient. My mom said, ah man, and my godfather was like, no, let's follow up because he saw the swelling on my hand, and my mom said, it's dislocation. What? They went to my grandfather's place. He drew the hand, and they said, but tap on her door, and she slept. No, you understand that kind of thing until the doctor said she's a sickle cell patient. My mother says sickle cell patient. Okay, my father say no now. And my wife now AA. My father, my mother say I be AA. So you understand that kind of thing.
Yeah.
So they had to go through counseling before they had to accept, and they came to realize that hospitals make mistakes, lab, and that's why now we advise as a youth, go don't just rely on your first test or your just do it as often as you can to be sure. Maybe the ones that is more will be like, okay, that is it. So that is, and before you know it, that depression will come upon your parents. At that point, they will not have time to even lecture you on, okay, this is sickle cell, my love, accept yourself. But at that point, they just want to heal you because the fact where your mother or your father is having sleepless nights, spending a lot of money, because just being a sickle cell patient is very expensive to maintain, to be honest. And so they just want to find peace for you and find peace for themselves. Before you know it, they start going to prayer houses. They start going, my pikin must heal, my pikin. Well, we believe in God, whoever we serve, there is nothing that is impossible for him. So some actually change, based on some stories I have heard. Yes. So all I can say is God can glorify himself in any way he can leave you with it and he can still leave you for his purpose. So that is just all I can say. Yeah.
Fine. And then there is this myth about sickle cell. Even before pharmacy school, yes, I had this knowledge that a sickle cell patient can only live for 25 years. What? Yeah, something like that, 25 years. Yes.
They don't add the age.
Oh, they don't know at the age. I mean, tell me something. Tell me something.
A lot of people will say 20 years. 20. Sickle cell, don't know the class. They know the if you don't reach 19 like this, thank God. Though. In fact, I will say that is like one of the first stigmatization sickle cell patients go through. Yes,
So you don't carry your
that age, that age, and the fact where a lot of people forget that God exists at that point. That's the word I use to a lot of people, because you'll be like, oh, how old are you? And you'll be like, I'm 19. Oh, how can you 19? You know that looks and all. Like, it's so annoying. Like, it got to the point in my class, I felt like my friends have this imaginary dates, to be honest, waiting for me to be like, okay, Mimi, are you fine? You get they are waiting for the next day that she's gonna die. So I feel like it's like from our teaching right from secondary school that affected this, because I'm not saying they are our teachers before are not educated, but the level of education they have on health issue, that is when teaching us biology and chemistry, the rest, they have low education or low teaching on it, and then they transfer it to the students, and then when the students grow up, some of them just have poor knowledge and they don't even want to learn more or to even have that interest in it and be like, oh, this is cancer, or oh, this is this, I want to know more. What does it take? They just want to be like, oh, in my school they taught me sickle cell patients don't used to die, don't used to last, or this person don't used to. That's just that mind mentality that they have. So I just feel that is it. Yeah.
More. That's not really a nice thing.
At all.
Like you said, like some of your guys,
I felt
your friends.
yes,
Your
I
friends.
felt you get they'll be like, Miracle, are you fine? How is your so they'll be like, okay, she wake up today.
What is your words to them? Yes, the management of the stress, and then what you should do and all that.
Well, first of all, like I said earlier, I mentioned the triggers. So for you to avoid such, I can actually say crisis is not something you can avoid. To be honest, one of the biggest trigger apart from those stuffs I called earlier is weather. Someone like me, from heat season to rainy season, when it's about to switch, I have to go through that crisis. Why? Because my body is trying to adapt to that new season. You get? So, but I would say one of the biggest management is hydration. Water, water, water. My friend at home, her mom will like write a very big note. Cuckoo, drink water, cuckoo, drink water. And me, my mother will say, Kido Karua, if I say I'm going to somewhere, Kido Ka. So you just always have, and then you need people around you. When I mean people, I mean genuine people that, like I said, it's not everybody that is interested about health. Not everybody that wants to know about health. You can tell this one, I'm a cancer patient. I'll be like, oh, sorry about that. I want to live their life. And then you have them around you. So you ask yourself, this kind of people, is it somebody that if there's nobody there, they know what to do? So you get what I'm trying to say. You need to have intentional people around you. Because if my mom is not there to tell me, Mira, drink water, I have my friends in school. Farida, Mira, drink water, Joseph, me, like they are always checking up because they are intentional. They just feel like, okay, you are worth helping to fight for. So you need those kind of people around you to remind you, because I don't know, but basically me and like I said, I can speak for myself and about 70 others. There's another thing that we low key go through, and that is amnesia forgetting a lot of things. So I can say, okay, I want to carry water and go out, and I will forget. So when you have other people around you to help you stay hydrated, it's one reason, like one factor that helps you. And it's also important to take your daily medications. Like you said, even me, my own foundation, we're not going to mention the names because we don't work on that, because we came to realize that that's one of the reasons, or one of the biggest issue now we are facing when it comes to medical attention in the hospitals, because we have a lot of cases that we went and a lot of people be like, oh, this drug seeker have come back again. You get?
You see her as an addict or something.
Yes. A lot of, sorry to say this, but a lot of medical personnel out there see sickle cell patients as drug addicts or drug attention seeking vampires. When you say, oh, I'm having a crisis, you'll be like, you are supposed to be used to this. No, to be honest, somebody told me that. So this one is not something that my friend told me. That's this in particular that I'm sharing with you. She was like, are you not used to this miracle? Because I am used to going to the hospital. And she was like, are you not used to this? At that point, I wanted to answer her, but I'm like, this is the way I they go through. Make I first recover first. But my other friend would be like, I they use this crisis, give that any nurse or any doctor will give me bam bam, myself, I will give am bam bam. But at some point, like I said, the crises are of different stages and of different stages. Let's just say stages. So at that point, we don't advise you to take this, because most of the drugs are given to you based on some tests you run. Like my drugs, they are given to me based on my weight, because I can go back and the doctor will be like, what is your weight? And if I tell him, he'll say, okay, reduce to so milligram or increase to that. Yes. So take your routine drugs, even though we know it's not easy to follow those rules.
That's my next question. Like I'm just that's what I want to ask you. So do you take your medication as prescribed?
I will try now.
You
I will try.
Okay. She has been talking about hydration.
Yes, very
Okay.
important.
Please. Doorstep Healthcare Nigeria Limited is here to hydrate you, please. What that means? Can these people, yes, these persons, these champions get support? You think, yes, apart from family and friends?
To be honest, I think one of the first biggest support we need is health care attention. To be honest, lately, care is attention. It baffles me. It baffles me. Like I said, Cohort Sickle Cell Foundation, we deal with a lot of sickle cell patients. So last week, because every week we drop questions to know more on individuals living with such disease, because we want to know how, because we call ourselves like mind to some extent. Why? Because we share same pains, same, I'll just say everything about us is the same. So we, Cohort Sickle Cell Foundation, we ask questions, analyze, and come with a solution. So our question last week was, what can you say about the medical attention of our country? And they were like, the answers they gave was, I felt like crying. Like, to be honest, I felt like crying. It was so disturbing. I was like, who are we going to run to? Because the fact that, I don't know, it also comes to the fact where a lot of people don't give attention to health. Let's even keep sickle cell aside and get to understand that health is wealth. A lot of people just feel, I'm okay. I no get, like when we were running this street campaign and we're asking them, what is your genotype? There was this guy that was like, I'm in an AAIB. I was like, how you know saying an AAB? I know they sick. I was like, And my sister was like, you know they sick, now you make you, they say you be He's like, nah, I know they sick. So all these are things that I feel we need to know, because the more we know more on health and education, or the more we are educated on our health, is going to help us. And even our medical attention is very poor, because thank God for, will I say, education now, and thank God for science and technology that is improving, will I say, every single day. Every single day of our lives is improving. Because before, in the history of sickle cell, a lot of people don't call it sickle cell. They call it, permit me to use the word in Hausa, bori, hauka. Why? Because when you are going through that pain, a lot of people have how they react to the pain. Yes, that is history of sickle cell that we have. A lot of people see it as bori, because when you are going through pains, you are just screaming, rolling, trying to look for relief. So at that point, we realize that a lot of people before would just tie you, like because they didn't know what you are actually going through. But thanks to education now, we are able to know what it is, that is the sickle cell, and we know it's what is caused by what, the red blood cell, and it's transferred from your parents to, you get what I'm trying to say. So there are a lot of people that are having studies to it, but I'm saying this because I am one and I know how it feels. We have poor knowledge on that. Sickle cell is not something that is just like a one thing that you experience and it will go maybe till another day. It's something that even if you are recovered, you will go through it. Like, that's why, like you mentioned earlier, we have to accept who we are. Is accepting is easier said than done. Like, for you to accept that I'm going to experience crisis at any point of my life, anytime. Like, I have a friend that is going through sleeping disorder currently because of his crisis. Why? Most crisis comes at 11 p.m. So imagine, I want to just make an illustration here. Just imagine you going through pain, crisis, 11 p.m. in your area, coping up with this no security here in Nigeria and in some areas. And then your parents are not mobile, and then your street is not safe for them to take you to the nearby hospital. In fact, there is no even nearby hospital in your side. Like I said, sickle cell affects what? The red blood cell. You are struggling with oxygen and blood, and then there's no painkiller to sustain you in the house. And then you have to cry from 11 p.m. down to 6 a.m. And then you're taken to the hospital. There's nobody to attend to you. There's no doctor on ground till doctor comes. And then when you leave your house going to that hospital, you are forgetting that trauma that you went through from 11 p.m. You hear what I'm trying to say? From that 6 a.m. And then you're like, okay, I'm going to get relief. And then you go and then you be like, doctor never come, doctor till 10. And then they take you to emergency. You are lucky you get someone that cares about you to give you the attention you need. And if you're not lucky, you get a nurse that will tell you, my shift's not finished. Say shift in the morning, so you get, it's something that has to do with your hemoglobin. And it's like maybe 6% or 4%. Do you know what that means? And at that point, when a sickle cell give up, so because he was struggling to fight for oxygen from that 11 p.m. down to 6 a.m. And then he decides to give up because what? The energy, the oxygen is no longer, he don't have strength to fight for it. And those people say, Aga alayaso. And now we lose a lot of sickle cell patients out of what? Out of those carelessness. The most important thing is that health attention, because the pains are of stages. Like I said, you will feel the sharp pain from your back. Yes, paracetamol can work. But what if stage 2 comes? Paracetamol will not work. And if paraventure, it leads to stage 10, even the other painkillers I'm not going to mention will not work. Why? Because the more you go through pain, each minute you go through pains, the weaker you become.
Okay. Yeah, I wanted to even do pharmacy thing like I left, but I would not say what I wanted to say. Yes, I wanted to just do pharmacy thing. Okay, I will just keep it.
The more
So it is
pain,
even
yes,
the
the more pain you, the weaker
become.
you become. Because at some point when I'm going through crisis and they are rushing me to the hospital, the only thing I can hear probably that 11 p.m. and my parents are like, my dad will be like, let's go to hospital. I don't care how we are going to do it. and there'll be car. Okay, let's go to the hospital. That night, the only thing I'll hear is my mom trying to rub my hand and calling my name, just for me not to leave her.
Yeah.
Because at that point, she have more education than me,
Yeah.
because she has taken care of me right from. So she knows what can happen to me and what cannot. Like, that's why I said you need people around you that care for you. So at that point, she'll be calling my name, Mira, like, just for me to be answering her before we get to the hospital. And there are some hospitals that she will take me when she notices the crisis is severe, because immediately we go there, we get proper attention. Except if I say, I can manage, then she'll be like, okay, let's go to your regular hospital. So all those things is important. Even if it's in school, in the hostel, my friends will be like, Farida will be like, Mira, oh yeah, stand up, be eating this thing or be taking this thing, just to keep my attention. So all those things are very important. That's why I said the first thing we need is proper medical care.
Please, everybody should have a friend like Farida.
Please have a friend like Farida, or have a friend like Timothy.
Yes, please have a friend like Farida.
So we need all those things, and then again, we need care from the people around us.
If I know we've talked a lot, and then
Yes.
but we point some of the things out of what you've spoken. We will not just need a family, friend. We also we also need a proper healthcare system.
Yes.
And then we also need a community.
Yes.
Just like you mentioned, you throw Christians in your community. Even in that, please, the stigma thing, it's something we cannot change. But and then even you as a person, don't make yourself run away from people. Please, you get, just do your best, do your thing, live your life. Just like with the outreach she did, and then the other guy was just, I need a force, I need a force.
Him be him be
Don't worry. Now SSB, and then you are human too, please. You are
I
human
don't care
too.
anybody now. SS I get.
Thank you. You don't care anybody now. SSB.
I know.
Yeah, the SSB. Okay, so are you aware of any because apart from cohorts, yes, apart from cohorts, is there any other foundation you advise people to join? Because I know cohort is apart from being online, you people are physical, you people are here in Kaduna, right?
Yes.
Good. So is there a means you can also tell us about cohort? Is there a means someone who wants to join? And I'm sure cohort is not just a space for only sickle cell people, right? Good. So is there a means if someone wants to, and then please know that you want to join, just come and join, just for what say.
They no fit join. Una no know the secretary wey we get.
So good. So nobody will not join. Please come join because you want to be like Miss Mother. Please, I will just say that.
Because you want to be like the warriors mother.
Yeah, you want to be like the warriors mothers. So I don't understand the mother. How about the father? Okay.
No, our fathers. The reason why the fathers are not exempted, to be honest, I am not even going to hide that fact. Like, the reason why I'm calling mothers is because most times when it comes to sleeping in the hospital and most of those pain management, like those other exercises, the warm water, these are mostly carried out by the mother, be it a male or a female. The first person you want to call is my mom. Why? Because daddy have to go and struggle. Like I said, sickle cell is expensive to manage. So you have to go and source the money and all. But my dad, they do everything wey my mama they do. If crisis starts, na my papa go carry me go bathroom, na my mama go bath, dress, come back. If they say, okay, Aje Junction, na my papa go carry Aje Junction. If they do Tamagani, na my papa go home, they massage the back, they massage the leg, me mama go bring. So it's like,
they do it together.
If you have it, they need, like, you need a support system. Yes, that support system is very important. It's very important. Very, very important.
Thank you. So how do you see doorstep healthcare in Nigeria limited? Fortunately enough, we are two in Kaduna. Yes. So what is the room for us?
So, like you asked me earlier on the management, and the first thing I called is the health. Drugs are expensive for some people, to be honest. There are a lot of sickle cell out there that are struggling. that are struggling. In fact, I'm sorry, but I'll have to call a drug just to provide folic acid. Some people cannot. Yes,
Folic acid.
folic acid.
Is
Like
when
I
you guys
said,
doing another
we
awareness or
do
something?
outreach, but it's basically September because
September.
September is World Sickle Cell Awareness
Month.
Month, the
Okay.
whole of
The whole
September.
September.
But June 19 is World Sickle Cell Day.
Okay.
Yes.
Okay. Okay.
So you find out that there are a lot of people that can't afford, because like there was this time I went for a checkup and we were together, like I said, a lot of sickle cell patients, and we tend to communicate more. If we are to follow reality, we girls, we have pride. Guys to guys go feel meet,
Ah,
bros, how
very
far?
far, very
They don't
far, very
hug.
sharp,
But
sharp.
girls be like, "Hmm, hi," and all. But as a sickle cell patient, when you get to your appointment, immediately you meet your sickle cell, you don't have to do all those pride. Hi, how far? We relate more because we feel we understand each other. Forget you have parents, forget you have cousins, but there are limits to their patience and understanding. Because
Very
at
true.
some point, some of
Very
them
true.
will be like, abeg, you are faking it, or it's becoming too much to some people that don't have understanding family.
Very true. Very
Like I said,
true.
it also affects us mentally. So at that point, you get to relate, and then you see some people. There was this lady when they said, "Okay, they've increased the price of one of our drugs," and she was like, "Sickle cell ma da ba mu muka ma ba ma kanmu ba ma communicate with this bane iyayen mu suka haife mu da shi." She was so beat hard, and I was laughing. I was like, "So ki daina mana." She was like, "Don Allah ki bani in fita zuciya na." You know that pain that she was going through, and at that point, I didn't want to judge her because I was like, she's probably the one getting her drugs, or maybe her parents are all this. I don't care. They just give birth to her and she knows what she's experiencing because we have them. And I just laugh over it. And everybody started just and be like, Kote Mekenio. And they started calling other health and be like, I didn't is this sickness. I was like, oh, the sickness, then to the get waiting, they go, they say, that we should allow them to pour out their mind. So you see, at some point, if we have, okay, these people are giving us these drugs, like on a discount or this, even though we know that still a lot of people cannot afford, but some people will be able to afford. And before you know it, if Mr. A is capable, he can decide to get his routine drugs from Mr. B and Mr. C. And before you know it, it will, because we don't even have free healthcare here.
Yes,
You have to pay to see your consultant. You literally have to pay for everything. That is why I said sickle cell is a very, very serious issue.
Please, sincerely speaking, this is actually a big call. This is actually a big call for the fact that sickle cell don't really have what's it called, a subsidized
We don't.
healthcare plan.
We don't.
Probably okay. I don't want to rule it out, yes, because I'm a
Yeah.
healthcare professional, but
Yeah.
probably there is, and then we don't have knowledge to it, or it has not reached to our community.
Not
Don't
that I
worry.
know of.
Okay, I bet you
Yeah.
we will try, and then
No problem.
Before September, yeah, if yes, I would we'll try from those type of healthcare. We'll try and then see what will happen. And then for folic acid, I bet you those type are giving it. Yes. For if you guys do any awareness by September,
We are
I bet you
grateful.
that
Go on
we'll
Sickle
do
Cell
that.
Foundation will hear
We
this.
will do that. Seriously, we will do that. That's from doorstep. And
Yeah.
then so also for the drugs, I know some of your drugs are prescription drugs.
Yeah.
Yeah. Then so
Yeah.
I appreciate how formal, how coordinated cohort is. So and then I don't need to ask. I know you people have details about all your patients. You know
Yes, we
them. You know.
have.
So those episodes also giving you this room because our vision actually is to help reduce this hospital going thing. That is one of the vision of Doctor Healthcare Nigeria Limited. Is we want people to get their medications, to get healthcare, like professional healthcare in the comfort of their homes, their offices, anywhere. Yes, the location is not an issue for us. Get so we will try as much as we can. Yes, to get your details so that somebody will not just come and tell you the person and will unfortunately will just do yes.
No, we
So
don't.
yeah,
And actually, from Cohort Sickle Cell Foundation, we have a specific number of people. Our
and we
members,
know all of them.
our team, not even we know all of them, they have an ID card. Yes, they have.
So,
Because
see,
we don't want a point where this one will claim this one will claim why, because we are a group that are after the affected. because we have a lot of, like you asked me, actually, we have a lot of sickle cell groups out there. I'm actually in about 3 to 4 of those groups.
Okay.
To be honest, I am. But before you start, like they said, you fit see 5 people they do business for one street, but it's how good that you are. So we here, we came to, after analyzing and studying a lot of things, we asked ourselves, how can we be different from other people? So we are there. Yes, we provide counseling to those that haven't accepted themselves, because like I said, accepting sickle cell is not something that is funny. Yes. So we provide, and there are some people that before they found out that they are sickle cell at the age of 20, 20 something, 30, 30 something. So we also offer counseling. We have guidance and counseling. We have legal practitioners in that group. And then we have caregivers that have a sickle cell patient, or have, because there are some people that are naturally born with this care for somebody that have a health issue or something. We have them, and that's why we call them the caregivers. And then we are always there to support the affected and the family, that's the sickle cell patient, to help them in any way we can, because a lot of sickle cell patients find it difficult to make friends out there because of how they are being judged. Oh, they always fall sick, you don't miss this hangout, you don't miss and then they have to keep explaining themselves, and make it difficult for them to make friends or even be in a stable relationship. You get all those things. So we are just there to be your home, to be your friends, because we understand what you're going through, so you can bring your problem and share it and give it to us, and we'll just laugh over it and cheer you up. That's just it.
Sincerely speaking, Quartz is doing a lot. And then doorstep are here.
Thank you
Yes,
very
we are,
much.
we are here as a home for every single self person. So please, I will appreciate if you have the ID card. Yes, and then with that, we can also help see how we relate with pharmacy, not a chemist, please.
Yeah.
Pharmacy in an environment where we can see this person, this is ID card, it is true, and then the person can go. Yes, and then we'll see how we'll be through with that person, and then the person can get some of the medications that he or she must.
Needs.
Yes, must have. Yeah. And then I would lastly want to ask. So with all we've gathered, with all we've discussed, sickle cell patients can get married.
Yes, they can. I have them. I have them. If you want them as live testimony, they have. Some of them give birth to twins. I have them live. And they can also last long. I have a mommy that is about 70 years currently.
Please,
So
sickle cell patient
it's not a killer disease.
not a
It's just
killer
those
disease.
those stages that they
Yeah,
go
that they
through
go
and
through.
all.
Yeah,
So that's just it.
then it is a worthwhile. So I I I wish I didn't even mention from the beginning that I am a pharmacist. That is my giver. I wish I would have just
We
said
will no can get
I
title.
am back in my giver. No, so that probably, but no, I'm sure you didn't
No,
highlight it. You just
it's
mentioned
very
it. You just
important.
I learned.
That's why a lot of people, and we also try to tell people that yes, you are a medical doctor. We need to work hand in hand. No be you go tell me wetin I dey go through
No,
for
me
my
the
body. So you see, I am going through it, and I can tell you this is what I'm going through. And then you that study it, is left to you to be like, okay, try this. Someone like me, thanks to the doctors I have encountered, my doctors, they since right from growth and the counseling and everything, I know what my body wants and what my body. Before you give me any treatment as a new doctor, you have to explain this treatment is for this. I know things that my body is allergic to. You can give me this dose of drugs and I will react to it. So I'll tell you, no, don't give me this treatment because it's my body. And when you give it to me, I know how I react to it. So that's why I said, most I'm calling out to this you people.
We are here.
Let's work together. Understand us. Yes. We help you people and you help us. And you see, your lives is becoming simple, treating us, and we too, we are getting recovered. We recovered fast. So that's just it.
Tell me, it is a time well spent. We appreciate your time. We appreciate you coming. We appreciate
Thank you.
all you have dished to us. Just begin this food and is sweet. Like, like You really give us, even with chicken, you give us everything, the turkey self, everything. Then we
You're
appreciate.
welcome. Then
We
you people will
appreciate.
have
We
to pay us
appreciate.
for this information that we just leaked to you people.
Okay, okay. Doorstep is here. Sincerely speaking, doorstep is here. Doorstep is here. Um, thank you, listeners. Thank you for your time. Thank you for all that has been said. In summary, a sickle cell person. Yes, I will not say patient because I just learned today
A sickle
that
cell warrior.
a
Just
sickle
use
cell.
the
Okay, okay.
warrior.
A sickle
Yes.
cell warrior is a champion. Not just I don't know why I just want to say he's a person. I don't know that word, a
Now,
person.
person they get them now.
Yes, he's a person. Please stop the stigma. Yes, and then you yourself as a sickle cell person, please just try accept it.
Just
Yes,
accept.
there are people too that are living with you. See, there are people that are living better. When you relate to them, you will live better too. Okay, those that cannot afford, please, probably it's because you don't have the knowledge, yes, of how you can get help, of how you can get cheaper drugs. Yes, because there are stores that sells on wholesale prices, or probably there are people that are in a store that have registered and said, okay, if this is a verified single cell person, we are subsidizing for him or her. Please, let's try relate to people, support system. See, another thing again, your support might not necessarily be from your parents or from your loved ones. That is another thing you should know. Yes, it might be a friend like Farida. Yes, yes, and then your parents. You can be a fortunate person that your parents can be miracles parents too. So please, like we've had today, support system is a good thing. And then I will say, be hydrated. Thank you. This is Doorstep Healthcare Nigeria Limited.